This is an interesting case of a 75-year-old patient who had previous decompression and now has developed severe claudication, bilateral lower extremity radiculopathy, back pain. Just a few years after the decompression, symptoms returned. He was set up to get a surgery, but the surgery got cancelled because patient has a BMI of 51 point something, almost 52, and the surgeon deemed that too risky to do the surgery. As you see, you're dealing with spondylolisthesis, which seem to be actually mobile, and as well stenosis in this area that explain the claudication. This surgery was done yesterday, and this is what we did. Obviously, we adjust the films here. I have to get some boost to get a good picture, but we put the patient prone and we have two C-arm as you see in real time. At this point, you see that I'm just getting my orientation, but then about this time, actually this is one of the summertime, winter time, but we start the surgery around 2:50, and then here the Jamshidi goes in. Then I put the dilator in the first disc. We do a discectomy. I put a 33 millimeter long and 11 millimeter high spacer cage in with a transcambine approach, all minimal invasively. All three cages go through the same skin incision, which is about a little less than an inch. And at this point, I'm putting as well the K-wires in the L5. Then we reposition and pay attention to the next level up. Again, you see that when I put the spacer in, it opens up the space, and we put the Jamshidi, then put the tube in L3, 4, perform a discectomy, prepare the end plate, and put a cage in. Again, it opens up the space. So, and after putting K-wires in the L4, we now put K-wires in the L3, and now pay attention to the most upper level. Again, we use a neuromonitoring probe. We enter the disc, then prepare the end plates, perform a discectomy, then we put a cage in. And now only the upper two discs, upper two K-wires are placed here. And then at this point, actually the AP machine comes out, and the rest of the surgery is done on the lateral. This is the device we call decorticator, which decorticates the surface of the bone. Then the screws go in. If you remember, the surgery was started at 2:50 or something like that. And here the screws are all in and the top of them is removed. This is the final picture, and this is the final picture in the AP, and it's 3:46. So in less than 1 hour, the surgery is done. With this closing the skin, the total surgery time was 66 minutes, and the blood loss was 70 cc. This patient already walked right after the surgery. The surgery was done yesterday. Most likely, patient will be discharged today. Again, with a BMI of 52, that open surgery deemed to be too risky. This surgery can be done very safely with the transcambine MIS, very efficiently.